Who wants to have a baby? Raise your hands. Okay? And who wants to spend $20,000 a year having a baby on childcare? Raise your hands. Okay. Now, procreation is the reason why we exist today. And thousands of years have gone by and women have managed to do everything. The childcare industry, which began after the Industrial Revolution, has become a lucrative and almost out-of-budget amenity that is beginning to make young adults reconsider on having children today. Let's change that. As reported by Project Innovation on November 30, 2011, licensed child care centers are over 80,000 and growing in America. Imagine how many there are today. They have become a lucrative source of income for these facilities, and the middle to lower class population cannot afford the costs. Should we refrain from having children because of this? Absolutely not. Child care is a service that I'm familiar with. I raised 3 children. And I've been through many institutes, private, public. I can say that besides the cost, children get sick, there are noticeable change in personality, sleeping habits, eating habits. The European communities pull together to balance the cost of childcare by creating a space in their community, in their houses, and provided by the neighbors. This service is something that is free. According to Social Science Quarterly, September 1, 2001, women in the workforce are looking for ways to supplement childcare by recruiting family members. Both parents work, single parents work, everyone's working. You want to get grandmother, you want to get the cousin, the auntie, everyone's busy. We don't have people to watch our children. Now, something that has already started in Europe can be a great model for implementing in the United States. Today I'm going to introduce a positive outcome of children in communal living. I will demonstrate the child care costs as inaccessible to the average middle class income. Then I will introduce the risk of illnesses, the different situations that daycares unfortunately have. Finally, I will show you how easy and economical it is to organize childcare within the community. Childcare cost is inaccessible to families. The average American household income is less than $60,000. Every state is different, obviously. Social Science Quarterly, September 1, 2001, states that for the average household income, we need at least $1.87. Okay, this is 2001. I'm not even going to tell you how much we need today. We need to set aside the numbers for this. No, we need to set aside the numbers to have these children go to an education when they get older. Households cannot spend more than 10% of their annual income on childcare. Most childcare facilities cost anywhere from $5,000 to $15,000 a year. A mother's employment decision is tainted by this. Career women will have to take a salary cut if they want to spend quality time with their children. We can see that the average household cost and employment does not match our needs, and we will take a look at the disease factors incorporated by these facilities as well. So preschool age children will get sick sooner attending the child care facility. First of all, most families at work will send a child sick, even if they have a small cold. It's not that they don't care, they don't have an option. The Scandinavian Journal of Primary Health, March 1, 2006, states that children who attend daycare contact more infections than children who do not, especially respiratory and ear. It's very hard to get rid of. Not everyone has the same hygiene. Not everyone believes what's sick. Infections and obesities cannot be predetermined by facilities either. Although public facilities that are monitored by the government require periodical evaluations, some disease may be overlooked due to the minimal one-on-one time that they have with the child. Although meals are balanced in facilities, the child could have eating habits that are different. They could have eating disorders that they're going to get into. We can clearly see that the income and health issue when looking into child care facilities is not all there. If you already live in a neighborhood, then communal living is a part of your life. You can easily organize a system where families pool their free time and create a preschool daycare setting that is small enough to manage. And guess what? It's free. If you already live in a neighborhood, then a communal living is a part of your life. You can easily organize a system where families pool their free time to create a preschool daycare setting. According to Generations, December 1, 2013, the size of a community matters in the social health, mental health, and general well-being. Communities are small and neighbors know each other. You know who lives around you. It makes it easier to trust people that will engage in service. Quality of life in a community where demographics are very similar as well. People tend to pool together, same culture, same ethnicity. One of the important aspects of a community in childcare is that people who live together have a tendency to do better. Taking care of children in your community where similarities occur can benefit your child in diminishing illnesses, can add value to the quality of the care, attention received, and the food that they eat. You can pool your free time and organize a dedicated child care community in your neighborhood. There's nothing difficult about it. That will bring solidarity within the community. It will allow families to get to know each other better. The children will create bonds with the children around the neighborhood. Families will be able to save money, feel more confident knowing that their child is within the reach of the community in case there is ever a need to support someone else. In our society, we have a tendency to segregate within communities, and people like to keep their privacy. We need to expand this. This communal method has been tested in Europe, and the results have been more than positive. It works well with families that have single parents, both parents, and also mothers that do not work. It is incredible to see how people pull together the resources when needed to give support and education to children when money is scarce. Let's do this community together, and let's save the world with children.
Good.